Well, good afternoon, everyone. And as we mentioned yesterday, we have a new face at our table today. Dr. Suzanne Brake is joining us, and of course, our seniors advocate, and she's doing a great job. And that would be my comments, and the information that I have has been coming in great news from Dr. Brake and for Dr. Brake. So I also have our regular team here with us today, and so for the overnight update, I'm going to turn it over to Dr. Fitzgerald, our Chief Medical Officer.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us. I'll start with an update on the number of cases in the province. So since the media briefing yesterday, we have 5 new positive cases. These cases are within the Eastern Health Region. Public health contact tracing is ongoing, and everyone considered a close contact will be quarantined. The total number of cases in our province is now 252. That's 234 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health Region. 52% of cases are female and 48% are male. And by age, we have 20 people under the age of 20, 37 between 20 and 39, 35 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are over 70 and above. 7 people are in hospital due to the virus, and of these, 3 are in intensive care. 170 people are now recovered, and in total we have tested 5,370 people. As the number of new cases has remained relatively steady over the last few days, it is clear that our individual actions are making a significant difference on our collective well-being. We must keep this momentum going. Please stay at home as much as possible, wash your hands often and well, practice proper cough and sneeze etiquette, maintain safe physical distancing, and stay home if you are feeling sick. These short-term sacrifices will go a long way in achieving our long-term success. Today, I have advised the Minister of Health and Community Services to consider extending the existing public health emergency order for another 14 days. To view the details of this order, please visit gov.nl.ca/COVID-19. These public health orders are reviewed regularly to ensure we are taking every appropriate action to reduce the impact of COVID-19 in our province and on our people. The measures we have in place are based on the best available evidence of what we know about this virus and what has worked in other areas. While there are still uncertainties as COVID-19 continues to evolve, we do know that it does not discriminate and can affect anyone regardless of age, health, or socioeconomic status. We also know that it is contagious and can spread quickly. I can assure you the preventative actions we are taking are our best defense. These last few weeks have proven difficult for us all and have certainly tested our resolve. However, the tenacity and determination you continue to show in these times of adversity is not only appreciated, but truly admirable. I thank you sincerely for your unwavering efforts. If we all continue to stay strong in our commitment to flatten the curve, I am confident we will succeed in this endeavor. Flattening this curve is about following the orders and restrictions in place, despite the temporary hardship they may cause. Please know these measures are in effect to protect you and keep you and your loved ones safe. The health and safety of our population remains our top priority, and we will do all we can to support you. Please continue to support each other as well. Maintain strong social connections while at a distance with your friends and family, and check in on them regularly. This is one of the best ways to take care of others and ourselves. Although we are more limited right now in our ability to do the things we enjoy, it is still important to maintain our hobbies and pastimes to the extent possible during this time. Things that bring us joy and purpose and activities that keep us physically and mentally well are very important. As a recap, for those who may have just joined, we have 5 new cases since yesterday's media availability. The total number of cases in the province is 252. The breakdown by health region brings us to 234 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. Please stay in your bubble and stay safe, and we will get through this together. Though it may be difficult to imagine right now, there will come a day when we will look back at this time in our province with pride, in knowing that it was not COVID-19 that defined us, but our own strength and resilience. Our collective actions will have a significant impact on how COVID-19 progresses in our province. So thank you.
Well, thank you, Dr. Fitzgerald, and once again, thank you for the reminder of the resolve that we have as Newfoundlanders and Labradorians. 5 new cases today. That's 5 people that received a phone call to say that they had tested positive for COVID-19. That's 5 too many. And we know that every decision that we make is with the safety, your safety, top of mind. We also know that some of the decisions on many of you have been difficult, and that every decision may not have been perfect in your estimation. But I can assure you that the work that we're doing is with you in mind. The work of our joint committee, our all-party committee, we still meet regularly, and it's about protecting you, protecting your family, and supporting all our families and friends in our neighborhood. Now, we know that everyone really will want to get back to a normal way of life, and of course, all of us at this table that is what we want as well. All of us would want nothing more than that. But the thing is we are where we are right now, and it's about safety, it's about protecting you, and about saving lives. So at the end of the day, it all comes down to making sure that when we do get back to regular life, we have those family units still intact. So in order to make that happen, we have to take responsibility and continue to follow the guidelines as our Chief Medical Officer just outlined. So it's important that we check in with our loved ones, check in with our family members, to check in and see how they are doing. So when we look at the decisions that we made, as I said, it's about your safety in mind. Now, one of the decisions that we made back in 2017 was put in place for the first time ever in the history of Newfoundland and Labrador, a seniors advocate. So we're very pleased today to have Dr. Suzanne Brake with us. And at times like this,
spread over a huge geographical area. Just over 100,000 people in our province are 65 years and older. So that's about 20% of our population. And 80% are less than 65 years old. As we grow older, many of us develop chronic diseases and conditions, and some of us have compromised immune systems. It's important to remember that this disease can be caught by anyone of any age. But if you are an older person and you catch this disease, you're likely to be much sicker and may possibly even die. And that's a terrible thing to think about. And I know that a lot of seniors out there are very worried and concerned about that very issue. So we have to learn, and we have been learning, how to protect ourselves and others how to protect us. The very best approaches have been explained to us over and over again, and Dr. Fitzgerald just explained them once again to us. So we as seniors have to self-isolate. We have to keep ourselves away from other people, and also the rest of the population must distance themselves from us and practice those same basic hygiene practices. I receive many calls and many emails and many texts, even in my own home, expressing concerns about what today and what tomorrow is going to look like. And as I see it, there are 3 different groups of seniors in our province. There are those who are very physically and psychologically able and capable of managing changes in their lifestyles. They can order their groceries, they can do yoga at home, they can figure out how to get their medications, they can put on a mask, and they can bring themselves to their appointments. They can bank online, they can socialize through Facebook and other social media means. What I'm going to say to you is keep up the good work. You are continuing to self-isolate and distance yourself when you're out there, and that's extremely important. But there's a second group of seniors, and they are those who may need some support and assistance in order to carry out those activities of daily living. And they basically do have family and friends and colleagues and friends from church, et cetera, who are willing to run those errands and who do connect emotionally with them to provide support. And I say to you, keep up that good work too, and continue to self-isolate and practice social distancing. But also, don't be afraid to ask and don't be afraid to accept support from your families and your friends, because they really are your angels and they really may save you from severe sickness. It's the last group that I'm more concerned about. They're physically and socially isolated, and many are very worried and concerned about how to navigate these confusing times. I understand that there has been a process that is underway to identify, to reach out, and to respond to these individuals. I recommend a simple but responsive process where seniors can email or call a central line, such as one that's already in existence, like Seniors NL, to somebody who these individuals can identify who they are, where they live, and what their needs are, such as groceries, such as picking up medications, such as picking up their mail, or what their social needs might be in terms of having a chat and being reassuring. The final step is to have a trusted responder from a variety of existing resources that we already have in place, such as the 50 Plus Federation with its 130 clubs and 6,000 members, or the Mount Pearl Independence Group with its 500 members, or the Coalition of Seniors Organizations, and I can go on and on. But we have a lot of very willing and capable and available people out there to help. So the next step is really about organizing that and getting it in place as soon as possible, because it is very urgent. I've heard from seniors a lot about the feeling of being socially isolated. And we all know that social isolation can have many negative effects, both physically and psychologically. It's funny that I've spent most of my career talking about social inclusion and urging seniors to be involved and engaged in their communities and society in general. And here I am now asking you to step back, distance yourself physically, but I'm not asking you to distance yourself socially. There are ways you can continue to be part of your community. If you use a computer, then go to church online. You can still go for a drive. You can learn new skills. You can enjoy the scenery. You can sit on your back steps and enjoy the sun. Or you can volunteer using your telephone to continue checking in on people who you know might need a friendly voice to help them through this time. Many of you have been self-isolating this whole winter, and certainly we've had a challenging winter. And now we have a different kind of storm in front of us and that we're weathering our way through, but I know that you can do it. I know we all can do it. So if you do need help, though, I encourage you to ask. Another issue that's come to my attention is a couple of days ago, I had heard a physician on the radio encouraging seniors to pay attention to their current health needs, because as we all know, many seniors age into chronic diseases and conditions. And we all know that stress can affect those individuals. As your seniors advocate, I encourage you to pick up the phone and call your doctor or the 811 line if you're not feeling well. Many doctors are treating their patients over the telephone, which is a wonderful approach, and especially for seniors. So please do not allow your current health conditions be affected of fear of going to a doctor or a clinic, or because you think you may be exposed to COVID-19. I've also received calls from concerned families and friends who have loved ones living in long-term care facilities or personal care homes. I'd like to speak directly to you. I know you are distraught and you are in anguish. I know that your loved one may be living with dementia and they may be confused and they may be worried and they may be scared because they don't know where you are. And my heart is with you at this time. But you have to depend on the staff that are there to connect you through electronic means or through telephone or even waving through a window in order for us to get through these times. As seniors advocate, I totally support the ban on visitors and more recently, the ban on portability of staff from home to home and even floor to floor in large facilities. Because half of the deaths in Canada so far from COVID-19 have been located in these facilities. It can spread very quickly, and the only way to control it is by limiting visitors and controlling access of staff. there is only one way for this disease to get into a facility, and that is through those individuals. I do have a few suggestions. I wouldn't be much of an advocate if I didn't have a few suggestions, Mr. Premier. I am suggesting, through information that's been given to me by families, by seniors, by residents who live in these homes, that there be inspections occurring frequently, especially throughout this period, to ensure that the policy of isolation is adhered to, and at the same time, to reassure families and friends that their loved ones are receiving the care that they require. That even stronger processes be put in place so that families can connect with their loved ones through electronic means and telephone. I recognize that this may be a very challenging process to set up, especially given staffing levels and the confusion that we're living through, but it is essential for the residents and their families. I'm also suggesting that a similar process be put in place in hospitals, because I've heard from many patients who are in hospitals or families of patients in hospitals that they too have become isolated and they are having great difficulty in connecting with each other. I think it was yesterday I heard that efforts are being made to limit the portability of home support workers as well, and provide them with extra protective equipment to be used and learning how to use them. This is, again, another essential piece of that continuum of care. The final issue I'm hearing from seniors is the impact of increased cost of dispensing fees. In anticipation of a shortage of medications overall, pharmacies have moved from filling a prescription for 3 months to monthly. Those seniors who are of very low income and in receipt of the 65 plan will not be individually affected, as these fees will be covered through increased availability of funds in the province. However, this has resulted in economic hardship for some seniors who are on a large number of medications, are on fixed incomes, and not eligible for the 65-plus plan. I'm hopeful that the increase in the GST, which I'm thinking may be in a lot of people's pockets today or tomorrow, may be able to offset some of that expense and that cost. But I'm also suggesting that anyone affected should speak to your pharmacy, talk to your pharmacist, and ask if they can reduce the fee somewhat. Further, I commit to continuing to monitor in order for us to determine whether the shortage of drugs has materialized as anticipated, and when can that supply get back to normal and therefore back to a 3-month supply for seniors. Today I've made note of some of the issues that impact seniors through the COVID-19 period. While there may be some room for improvement, I truly believe that most seniors have adopted a self-isolation and distancing approach, as hard as that may be for a nanny or a pop. But while some non-seniors, they are also practicing healthy social distancing and good hygiene practices and staying home when they're sick. So I want to congratulate all those people for doing those things and encourage you to keep going, because this too will end and we will all go back to a normal. I'm just not quite sure what that normal is going to look like, but it will be a new normal. If you wish to speak to my office, please call us. My number is 1-833-729-6603. Thank you again, Premier Ball.
Well, thank you, Dr. Brake, and appreciate your suggestions. And she sent some encouraging words through 3 groups of seniors within our province, and she said, keep up the good work to all 3. Well, I have a message for Dr. Brake, that is, keep up the good work. As we know that this is an unprecedented time for seniors, and some of them are experiencing challenges, and as Dr. Brake had mentioned, many would feel isolated. So I too want to take this opportunity to assure our seniors that they are not alone. We recognize, as been mentioned already, and we've highlighted throughout this week, that some of the seniors in our province, well, they are the ones that are really at a higher risk developing complications of COVID-19. So these briefings, as been mentioned already, is meant to keep people informed and connected. But also, I can assure you that as a government, we are working very closely with our community partners. And so we've been able to coordinate approach to provide access to supports and to those that are struggling to meet the very basic needs in life. An example of this would be the partnerships that we have in place with Food First NL, Seniors NL, and the Jimmy Pratt Foundation to set up one point of access for additional supports. You know, we have a tendency from time to time to set up toll-free numbers, and these numbers can actually creep up on you. And we were chatting this morning how important it is to have a coordinated approach so that people could have a single point of entry where possible. So this is a tool that we're working on, realizing how important this is to you, so that you can go into this point of entry so that you can find out the many resources that are available to you. I have to actually, too, reach out and talk about organizations like Seniors NL who are dedicated to providing information and resources specific to seniors' needs. And I want to thank them for their efforts. Now, collectively, our efforts comes down to helping our seniors to get food, and as been mentioned, medication, offering support for mental health, and ways to reduce social isolation. An example just recently is an extra $560,000 that we provided to Food First NL to establish a COVID-19 community food program support fund. Also, we provide funding for 150 organizations that have been approved for some funding from the government of Newfoundland and Labrador. And that includes 27 food programs targeted specifically for seniors. So our supports don't stop at providing food. We have a group called Connections for Seniors. They respond to homelessness and helping seniors who are in self-isolation, helping them with meals and other required supports. At this time, I would like to reach out and thank the department and their staff for the great work that they were doing at this very difficult time and working very closely with our community partners to deliver these essential services to our seniors. They are also working out and they are also finding ways in what is a crisis, a health crisis within our province, in being a little creative and finding innovative solutions during this challenging times. Dr. Brake also mentioned the 50-plus clubs within our province, and this is a very energetic, vibrant group that we see throughout many communities within our province, and thousands of people and seniors, as been mentioned already, are active members of this group. They're taking the time to put in place some one-on-one calls to support our seniors and to supply information to their members. It's extremely important at this particular point in time. We know they can't meet physically, but I am delighted to hear that they're staying connected in a virtual way. Now, all of these organizations and groups represent thousands of seniors throughout our province. These groups, staying connected, are essential in providing the supports that seniors need today. And not just during this COVID-19 pandemic, but I can say today that I'm extremely proud of the work that the seniors are doing in staying connected in our communities pre-COVID-19, and I'm sure, as Dr. Brake has mentioned, we'll be there post-COVID-19. Now, this week has been mentioned as well that Dr. Fitzgerald put in some new guidelines that would prohibit long-term care home staff from working in multiple locations, and Dr. Brake just reinforced the importance of doing this. And of course, this also applies to personal care homes. What this really comes down to is safety. So we are once again extremely grateful for the staff who go out of their way in making sure that our seniors are kept healthy, safe, and active in our province's long-term care and personal care homes. Dr. Brake also mentioned the complications and the impact that the extra dispensing fees and the cost of medications are having on many seniors in our province. And we recognize that. And I know Minister Haggie and I, along with the Chief Medical Officer, we've been talking about this and exploring ways to reduce the cost. We know now that through the foundation plan and the 65-plus plans that we have through the Newfoundland and Labrador prescription drug program, well, we've been able to find a solution to that so you're not impacted by the 2 extra fees. But we know this, we must continue to work, and we are working with the college and the board that represent the members of pharmacists throughout Newfoundland and Labrador, and discussions are underway that we can find a way and a solution to deal with this 30-day supply, recognizing this is putting financial hardship on many seniors within our province. And we're hoping to have some new information, very quickly on how we can actually deal with this in the coming months. When I speak of partners, I will tell you that one of the strongest partners that we have throughout all of this is the one with our federal government. And they're working with the provinces and our various organizations in our province collectively to support our seniors. Programs like Horizons for our seniors program, there's a fair amount of money that they've been putting there federally to support those through those programs, which will eventually find its way to support seniors within our province. They've also put some money with the United Way, some $9 million federally. Some of that will find its way into our province to support some of the most vulnerable people that we have in our province as well. So we will remain committed. We know that through strong partnerships, it's the best way that we can work our way through this. So those partnerships with the federal government and of course with the Seniors Advocate are very important as we continue to meet the needs of some of our aging within our province. And speaking of aging, we have a Provincial Aging Council on Aging within our province, and they supply and provide some great advice as we make decisions that represent this large portion of our population. So I guess when you bring this all together, it's important once again to recognize, as Dr. Brake has mentioned, the over 100,000 seniors who have given a lot in their lives to the development of our province. And as we continue now in their time of need, we must be ready to step up for them in what is extraordinary times in our province. So I encourage you, if there's a senior that's in your neighborhood, feel free to reach out. If some of them do not have access to a computer, then as a good neighbor, provide the necessary supports where you can to make sure that they can access the resources that they need and those words of encouragement during these challenging times. So I want to thank Dr. Brake for joining us today. I now hand it over to Minister Haggie for his comments and his insights on what he sees at the great work that the seniors are doing in our province, and I'm sure some colorful comments on his view as what has been happening and occurring in our province.
Thank you very much, Premier. Before I actually get into my remarks, I'd like to address an issue that was brought up by Patrick Butler yesterday from Radio Canada about the French translation for our self-assessment questionnaire. On looking into it, there was an issue. The translation was late and delayed, and we have remedied that. The translation is now up to date. Je vous en prie pardon. My apologies. We also now have access to 811 via phone line in both official languages, and all I can do, as I say, is apologize for that. From the point of view of today and the recent days, you can see a continued number of cases, and because of that today, I have issued a new order continuing the provincial state of emergency for another 14 days. This is statute limited and has to be redone every 14 days. That will carry us through to the end of this calendar month and enables the orders that Dr. Fitzgerald has made to continue with the force of law and regulation. I think I would like to commend Dr. Brake for her suggestions. They are timely. And we have here emphasized the idea of, whilst being physically distant, not being socially isolated. And I think her suggestions particularly ring true in that arena, and we'll certainly take those away and see how we can operationalize them. Picking up on some of the particular threads of her commentary, and maybe in no particular order, the issue around personal protective equipment for home support workers has been one that's been topical for us. We have in place mechanisms for long-term care and for personal care homes now, but I'm pleased to say that we have now mechanisms for both agency managed care, who can now access PPE when needed through the regional health authorities directly, and for those people who manage their own care needs, the self-managed care, their point of contact would be the individual who does their assessments, their case manager, and would be known to them. And again, PPE can be made available should the need arise. In terms of Dr. Brake's other comments, I particularly want to talk a little bit about care for people who have non-COVID-19 related issues. Not just seniors, but certainly for seniors. We have had commentary from emails and from calls to my office about a concern that their other health issues and problems are being maybe marginalized or forgotten. I can assure them that that is not the case. we've made sure that the VPs of medical services across the regional health authorities have been fully engaged in this. And my understanding now is that each regional health authority has an ability whereby the physicians working in their facilities can be contacted directly or indirectly. They keep an eye on their clinic lists. They are available for consultation, either virtually or, if need be, face-to-face, and that anyone who has health concerns there should contact their clinic locally or their specialist office there. The College of Physicians and Surgeons of Newfoundland and Labrador have issued very clear direction as recently as 2 or 3 days ago, encouraging doctors to be accessible for their regular patients, to discuss where appropriate by phone or virtually their care needs and ongoing requirements, particularly where there's a discussion to be had about specialist procedures or referrals, and to make sure that they are aware of the virtual care options that are now available. My office informs me we have well over 650 physicians and nurse practitioners who've signed up for that virtual care option. On the flip side, as Dr. Brake referenced, people do have concerns about going to healthcare facilities in case they may catch something. With the visitor restrictions now in place and the policies about masks and being met at the door and screened, I would suggest that we have done as much as is humanly possible to minimize that risk, and certainly anybody who's advised by their physician or healthcare provider to go to a facility for their care needs should not hesitate to do that. The final piece is around the issue of the dispensed fees. We were engaged very early on with the Pharmacy Board after they issued their standard practice procedure for pharmacists, and have been working with them to see what the art of the possible is about getting this amended. The Pharmacists Association, too, are very concerned about this. They have been excellent in the way they've stepped up in this crisis, providing frontline services, and they too are concerned about exposure to their staff, but also the worry of clients coming on a more regular basis than would otherwise be the case. They have moved very actively and proactively towards delivery options, both curbside and home deliveries. And I think that's not just a particular feature of, say, urban areas as well, because I know it's in place in rural too, and I commend them for that. They're also able and willing and are providing phone counselling around medication reviews and these kind of things for people who may be on a large number of medications. So again, it's an issue for us. We'll continue to work through that. We have just shy of 95,000 individuals on either our seniors plan or our foundation plan, and we have undertaken to meet the extra dispense fees for this group, a cost which will actually add about $15 million each year should this go on long enough to the NLPDP drug budget. So again, I've tried to address some of the concerns that have been brought to me and my department. The closing remark I would make is again to thank Dr. Brake for her work, to encourage seniors to be engaged and connected in the safest possible way. But the key message at the end of this is we need to make a bubble of protection around ourselves. We need to stay in that bubble, and we should not be out and about bursting anyone else's. But we do need to look at our sanity and get outside where appropriate and safe to do so to keep ourselves healthy. So I think with that, Premier, I'll conclude my remarks and hand it back to you.
Thank you, Minister. We now turn it over to the media for their questions for today.
Thank you, Premier. For the benefit of our speakers, we have 8 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues only. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they were registered for today's call. We will run through the telephone queue, and I will call on each reporter by name to ask questions. Please do not press *1 until your name has been called. Following this, should time permit, reporters will be individually asked a single question. This call will end at 2:59 p.m., and any further questions can be emailed. Our first questions today are from Elizabeth Whitten of all Newfoundland and Labrador. Please go ahead.
This was announced yesterday. As of today, testing for COVID-19 is being expanded to those with at least 2 symptoms. This is expected to increase the amount of testing done in the province. So I was curious how this is going to impact our burn rate for supplies.
The idea behind the increase in testing is based on, for most people, the use of drive-through testing sites. We know from other jurisdictions that this actually really reduces the burn rate significantly from a testing point of view when compared with the older way of doing it, which was to send a public health professional into someone's home and do the test there. So it was one full kit of PPE per swab almost. We have some easing of our supply issues with regard to reagents and with regard to swabs. So that is no longer a constraint. The magnitude of the increase is totally unknowable, really. We are still in the middle of flu and cold season here, and so there is a considerable overlap between the symptoms listed by Public Health Agency of Canada and those we would normally see at this time of the year. So we'd be in a better position to answer that question on, Tuesday of next week, something like that.
Thank you. And this question is for Dr. Brake. As a lot of people are concerned about the risk of their aging relatives who are in these long-term care facilities, what type of advice would you give to people considering taking their family members out of them and bringing them home?
Well, I certainly think that's an option that people have. Usually when people are living in a long-term care facility, it's because they have a very advanced or high level of care needs because of their condition. So I think that families need to be prepared for that. They need to recognize the fact that once they are at home, they probably will need home support services, and we'd have to explore and look at that. I mean, there are pros and cons. Some people are well equipped and capable and are not working in their offices right now, so they actually have the ability to be able to do this. But on the other hand, there are certain, types of care and needs that need to be met if you're going to be living at home, and often equipment as well. So those are all the kinds of things that might need to happen. I think it's certainly quite possible, and I think it's up to the family to talk that through with the long-term care facility and the healthcare system.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
I'm wondering what the province can do or is doing to mitigate the likely increase in domestic violence, which we've seen in other jurisdictions now because of the lockdowns and stuff. Are there any plans for a phone line or other support to help people who are fleeing a domestic situation?
Yeah, so we have a number of supports, Peter, that are already in place right now, and I know there's some of the federal government, and this is part of our weekly calls that we're getting as we start to highlight some of the things as the COVID-19 health crisis continues on. We know that we do not tolerate, of course, violence in any form at any particular point in time, but we know that as people are isolating more and families are staying inside more, as we get the pressures that on family life, just with reduced incomes and so on. Anytime you add stress to a family, it means that, unfortunately that, in many cases, women are finding themselves subject to violence. So we put support lines in place. We know that working with the federal government, there's some extra money that's going into transition houses, the core funding that we put in place as well to support a lot of women's groups within our province. So, we're aware and of the higher incidents as potentially at this particular point in time related to this crisis, and we want to be there to support those groups as best we can.
Okay, thank you. And I wanted to turn, perhaps Dr. Haggie can answer this, I wanted to turn the capacity question sort of on its head. Since we've got no major sign of a surge yet, even though it's supposedly coming, why aren't health authorities doing a small trickle of elective surgeries in order to avoid a huge backlog down the road?
That's a very good question, and it's one we look at on a regular basis. And it reflects really some of my comments about the need for ongoing care for non-COVID related problems. The facts of the case are we don't know what we don't know about this, and out of an abundance of caution several weeks ago, we took action there. There is a huge lag time between stopping elective surgeries and actually seeing the beds free up. I would think, on the basis of the data I've seen, it took well over 2 weeks to start to empty out the acute beds from people who had been in for elective procedures. The challenge is that because of the nature of this condition, should we start to see an uptick in cases on a daily basis, we know from elsewhere that we're within 3 or 4 weeks of a peak coming. Given that, it might be very difficult to then deal with a group of people who you'd brought in on a planned basis, but now have to get out quickly on an unplanned basis. But it's going to be part of the challenge of the new normal when we try and figure out what that right balance is between space for COVID and a surge and actually doing some elective work. Because at the end of the day, what may have been elective at the beginning of March, by the beginning of June, probably isn't going to be elective anymore. It's moving up in terms of its clinical priority, let alone the agitation the patient might be suffering.
Yep. Okay, thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
It was reported yesterday that up to 320,000 pieces of testing equipment, specifically swabs, were delivered to Canada but were found to be contaminated and thus unusable. Were any of those sent to Newfoundland, as you're aware, and was there an impact on testing capacity here?
From my understanding, that was a delivery that went to a mainland site where it would be evaluated, and the flaws were found as part of that evaluation. Canada has been using non-traditional sources of inventory and supply. And one of our challenges has been how to identify material that is fit for the job before it gets here. We are moving now to a situation where between the provinces there are agents who are our agents, as it were, who are able to assess product as it gets loaded for shipment by air from manufacturer or warehouse abroad to this country. So we identify, hopefully at that stage, what is not fit, and we don't take it, we don't pay for it, rather than this situation where we now have product we think we were going to get. At the moment, from a provincial point of view, we have not seen any shrinkage in our inventory that would shorten our kind of critical time. By that, what I mean is, what is the piece of PPE that we will run out of fast enough? At current rates, we have a week of everything, and some areas we have actually up to 12 or more weeks of inventory. So at the moment, we're good, we're getting stuff in, and it's matching the rate at which we're using it, even though it's nothing like what we've ordered.
I also want to ask a question about the fishery. May 1st is still the date for opening of the crab fishery. If we were to have a surge of cases here in Newfoundland before May 1st, would you, Dr. Haggie, as Minister of Health, or you, Dr. Fitzgerald, as Chief Medical Officer, would you have the authority to step in and shut down the potential opening of the fishery in that case?
I don't have any authority. Dr. Fitzgerald has all the authority. I just write the order that gives her the authority. So it would be made on public health criteria, and I would leave her to answer the detail of that, probably on the day that the question needs to be asked.
Dr. Fitzgerald?
So that, as Dr. Haggie said, we can only answer that question in the situation that it would come up. So we'd have to take a look at our epidemiology and what the risks are and where we see outbreaks, and all of those questions would have to go into consideration before we make such a decision. So I really can't speculate at this time.
I can assure you, though, with the chief medical officer has the wherewithal and the authority, not just for the fishery, but for any regulation that's required to prevent the spread of COVID-19. So us as politicians, we rely on the advice that we get from a chief medical officer, and the fishery is really no different. If we can't provide a workplace that's safe, where people can feel safe and go there and protect themselves from COVID-19, you can imagine that the regulation, the authority is in place. That's the key to the piece of legislation that the Department of Health and Community Services, put in place now a couple of years ago, and it actually outlines the role of chief medical officer and the authority that she would have. Her job is to protect the people of the province, and my estimation, she's doing a great job.
Thank you.
Our next questions are from Tyler Dunn of VOCM News. Please go ahead.
Thank you. My first question is for the Premier. Today, the Prime Minister said he'll be speaking with the Premiers about rent relief for businesses in the provinces and territories. Has this already been discussed here? And if so, what might that look like in the province?
Well, I think that question would be better asked probably tomorrow. We know during this crisis that there are many businesses, a lot of small businesses that are experiencing some very difficult challenges now, very little revenue and operational costs, and still trying to support some of their employees. What we want is we recognize that the job creators in Newfoundland and Labrador will be many of those small businesses. Many of them are struggling right now. So we'll have a call tonight. Usually these are long calls, and we'll be working with the federal government, and the province will be working too to add some supports where we can, given the impact that this is having on many small businesses within our province. And keeping in mind that when we get through this health crisis, we need those businesses to be in a strong place so that they can recover, from the financial problems and difficulties that they're currently experiencing.
Thank you. And for Dr. Fitzgerald, we keep hearing about the second wave or second phase of cases hitting
Tyler,
the province.
You've already asked 2 questions. We have to move on to the
sorry.
next order. Thank you.
Okay, thanks.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Premier Ball, are you considering bringing the House back anytime soon to deal with COVID-19 legislation?
Well, I default that to the leaders that we have in place right now. There's no date, but we work with our House leaders and the House leader of the official opposition, as well as the third party, and of course our independents. To put in place that we're ready. We've done it before a few weeks ago when we required the House to come together to get permission and to get authorization to go and borrow some much needed money, for the province. And if indeed we see legislation that's required to bring this House back together, of course the House leaders are prepared to do that, and then we'll determine how the House would look like, very similar maybe to what we've seen in the past. But if we're required to reconvene the House, absolutely is something that we will do to the benefit of the people of our province.
Thank you. And we're hearing reports that the COVID-19 case in St. Lawrence long-term care home was misdiagnosed. Is this true?
I'm not aware of that. There is a lot of rumor and speculation out there on a daily basis. We have no evidence to support that contention. We have tested the visitors that we've identified, the residents in the facility, and the staff who work there. And so far, no one else has turned up positive. And as was referenced recently, we have stopped staff from working cross-site. And until a period of 14 days has elapsed from that positive test, the emergency area of that facility will not reopen either.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Here we've seen wholesalers have said that vendors are raising the price on some essential items. Things are no longer being discounted. Ontario has put in legislation to prevent price gouging. What are we doing here in order to prevent people from taking advantage of the COVID situation to make more money?
Yeah, so right now, we've seen examples in Ontario. I think what you were referring to there, Peter, was when I think Premier Ford highlighted some of the price impacts that they were seeing on disinfectants and so on. We're not seeing that in Newfoundland and Labrador. I've spoken to many of the retailers, and that they've made a commitment that they would not see, some significant increases in the cost of essential products within our province. I haven't heard this from any consumer group or the experience, but I do know that there's expense side that many people are experiencing, and the last thing we want to see is this being downloaded onto the consumers within our province.
Last night we saw large groups of people at the gas pumps in Labrador as word got around that there was going to be a 30-cent increase. What do you have to say to people who are outraged about this and fear that their health and safety were put in jeopardy by causing people to have to do this sort of behavior?
Yeah, so, this is when you look at the work of the PUB and the Public Utilities Board that I'm referring to here, the work that they do in regulation of gasoline and products like, diesel and so on that we would see in our province. So what happened there, and I think what we know is that there was a large inventory that came into Central Labrador and the Straits area. So this is inventory that would have come in last fall when oil prices were much higher. And we've seen it, provincially, the impact of the lowering of oil prices. Well, what we're seeing now is the impact of the purchase of gasoline and so on that would have been bought last fall to have appropriate storage in place for the winter period. And so this was bought at a higher price, and therefore what we're seeing through the Public Utilities Board, through gasoline regulation, that price being substantially lower than the cost. So a submission was made to the Public Utilities Board to actually, correct this. Unfortunately, what we're seeing today is a significant increase of some 30 cents in those areas. But what will happen in a few weeks is that as this gets adjusted, we will see a dramatic decrease to reflect the new pricing structure. So it's something that has been a problem in this area in Labrador. It goes back to a decision that was made a few years ago, many years ago, I should say, when there was some advocacy that was done in that area to actually have it adjusted on a weekly basis. But it once again highlights the problems that we're seeing with the increase and the decrease in global oil pricing, and now it's having an impact in Labrador. But I can assure the people of that area that this is a short period of time, and you will see a dramatic decrease once a new inventory arrives.
Our next questions are from Drew Brown of The Independent. Please go ahead.
Province announced that it was instituting a new admissions policy for long-term care facilities and personal care homes. I was just wondering if you have a rough idea of how many of these facilities are currently in compliance with this.
What I can tell you about the admissions policy for long-term care particularly is that we have a policy now that applies across the RHAs. It is essentially to demonstrate that someone who is leaving an acute care facility to go into long-term care, and we still need that, because if you remember, one of our challenges in acute care beds across the province has been what we've referred to as alternate level of care patients, patients who don't need acute care but need a different kind of care that can be provided better in long-term care. So we need to be able to do that. These patients are tested before they go, and then they go into isolation under appropriate circumstances in the long-term care facility where they go. We have been working very closely with the personal care home operators who are equally keen to make sure that they don't end up with COVID-19 in their facility. And, if the recommendations are out how many tests and periods of isolation change, then obviously that will be done on basis of best public health advice. But it's an ability to move people out of acute care safely into long-term and personal care homes that we need to allow the system to be able to continue to function properly.
Mm-hmm. Absolutely. I was just wondering if you could walk us through the mechanism where government is just confirming that long-term care facilities and personal care homes are complying with this new admissions policy.
Well, the admissions policy, from our point of view, it has requirements on both the referring hospital to send the patient out in terms of testing, and requirements on the part of the long-term care facility. Long-term care facilities are different. They are accredited in the same way that acute care facilities are. So their inspection piece is somewhat significantly different. It's akin to an acute care facility. It's governed by the Patient Safety Act. There is access to all the services that a regional health authority would have in terms of infection prevention and control, and they would be the folk who would go in and deal with the actual education of staff if that was necessary. The RHAs would provide the PPE and so on. With a personal care home, we actually have a book now for the personal care homes. They've been very open to discussion. They've been really keen to adopt best practices, because it's in everyone's interest to do that. We have a regular inspection regime for personal care homes that's done through the regional health authorities. We also have additional requirements around specific care items. So, for example, there is a requirement for personal care homes to meet a certain nutritional standard and menu guidelines. So a community dietitian goes in to deal with that. We now have stepped up with infection prevention and control about making sure that their staff are educated. That's ongoing. And basically, the personal care home can ask at any time for further advice and further visits. Our caveat is that we really want to minimize the number of new people who go in through the doors. So whilst the patient is one thing, the resident is one thing, we don't want really a stream of social workers, dietitians, infection control people wandering through a building. We have really been very, very strict and a lot earlier in terms of strictness about keeping visitation out of personal care and long-term care. That's an upside from COVID-19, but as you heard from Dr. Brake earlier on, it has a downside in terms of connectivity and isolation, and we probably haven't worked our way quite through all of those elements.
Operator, would you please keep the line open past 2:59 so that our final reporter has an opportunity to ask his questions? Thank you. Our next questions are from Keith Doucette of the Canadian Press. Please go ahead.
This is for Dr. Haggie. Are there any of the province's long-term care homes facing staffing shortages? And if so, what is the province doing to make sure that there are enough frontline staff if you happen to have an outbreak there, such as happened in Nova Scotia and, of course, obviously in Ontario and in Quebec?
All our long-term care facilities designated and licensed as such, with the exception of one, are actually regional health authority facilities. The RHAs, the regional health authorities, advise me that they are not aware of any focal, local area of staffing shortage within those facilities. Should that situation change, then we have access to casual and float staff, again on the caveat that they work in one location rather than across sites. And further in addition to that, we have approached and got regulatory approval through each of the licensing bodies if we were under a surge situation where we can recruit and relicense very rapidly, even over the phone, recently retired healthcare providers, be they LPNs, PCAs, RNs, or that. So we've got a tiered response, and we don't have any information at the moment there is a staffing problem in those areas.
Keith, do you have a final question?
Okay. So I'm wondering about you said you haven't had your surge yet. Obviously, a similar situation occurred here in Nova Scotia, and then all of a sudden we've had a bit of a surge, and it's directly related to long-term care homes. Does that remain your biggest area of concern in all of this?
We are very acutely aware of the painful and sad fact that half of the deaths across Canada have occurred in long-term care and personal care homes. We have been very active early in terms of restricting visiting and then banning it altogether. And we have acted, I think, promptly to make sure that those individuals who are working in those facilities concentrate on one facility rather than moving between facilities or between facilities and outside activities in terms of other jobs. It still remains an area we will focus on, and I don't think our focus on long-term care will lapse until the wave goes and we start to look at returning to normal.
Okay, thank you.
Thank you very much, Minister. The time for questions has ended. Please join us again tomorrow at 2 p.m. Newfoundland time, 1:30 in Labrador.